ਓਟਾਵਾ ਦੇ ਵਿੱਚ ਫੈਡਰਲ ਸਿਹਤ ਮੰਤਰੀ ਕੋਵਿਡ-19 ਅਤੇ ਹੋਰ ਜਨਤਕ ਸਿਹਤ ਚਿੰਤਾਵਾਂ ਬਾਰੇ ਇੱਕ ਅਪਡੇਟ ਕੀਤੀ ਹੈ। ਉਸਨੇ ਦੇਸ਼ ਦੇ ਵਿੱਚ ਕੋਵਿਡ-19 ਤੇ ਮੌਜੂਦਾ ਸਥਿਤੀ, ਟੀਕਾਕਰਨ ਅਤੇ ਰਾਸ਼ਟਰੀ ਸਲਾਹਕਾਰ ਕਮੇਟੀ ਦੇ ਵੱਲੋਂ ਕੈਨੇਡੀਅਨਾਂ ਨੂੰ ਉਹਨਾਂ ਦੀਆਂ ਬੂਸਟਰ ਖੁਰਾਕਾਂ ਪ੍ਰਾਪਤ ਕਰਨਾ ਜਾਰੀ ਰੱਖਣ ਲਈ ਤਾਜ਼ਾ ਸਿਫਾਰਿਸ਼ਾਂ ਅਤੇ ਬੱਚਿਆਂ ਦੇ ਦਰਦ ਅਤੇ ਫਲੂ ਦੀਆਂ ਦਵਾਈਆਂ ਦੀ ਵੱਧਦੀ ਸਪਲਾਈ ਨੂੰ ਸੁਰੱਖਿਅਤ ਕਰਨ ਲਈ ਫੈਡਰਲ ਸਰਕਾਰ ਦੇ ਯਤਨਾਂ ਦੀ ਰੂਪਰੇਖਾ ਦਿੱਤੀ ਹੈ।
As the situation evolves, those border measures will be reevaluated. Our actions will continue to be guided by prudence, and we will not hesitate to continue adjusting them to protect the health and safety of Canadians. We're also putting in place additional wastewater pilot projects at the Toronto and Vancouver airports that will focus on direct flights originating from China and Hong Kong. Work is underway with industry partners, and these two projects are expected to start later this month. They will further enhance our ability to track the emergence of variants coming into Canada. These projects will build on the Pan-Canadian Wastewater Surveillance Network, which monitors the spread of COVID-19 in our country and is in collaboration with federal, provincial, territorial, and municipal governments, as well as with many experts across the country. Wastewater monitoring is a key tool for public health surveillance. It can alert public health officials to where diseases like COVID-19 and new variants of concern may be spreading. Earlier this morning, the National Advisory Committee on Immunization published their initial considerations for future COVID-19 booster doses for 2023. I thank NACI for their guidance. This is a good reminder that if you have not received a bivalent booster this fall or winter, it's not too late to get one and get better protected. Boosters remain one of our best defenses against the severe outcomes of COVID-19. We also need to protect the overburdened healthcare workers by doing everything we can to stay healthy. I thank Canadians for contributing to this effort by staying up to date on their vaccinations and continuing to practice individual public health measures, such as wearing a tight-fitting, well-constructed mask and staying home if sick. Earlier last fall, parents and caregivers were particularly concerned about their difficulty to find children's analgesics. As of today, 3.8 million additional bottles of these medicines have been made available to parents and caregivers through increased domestic supply and foreign importation. I also wish to inform parents and caregivers that a major pharmaceutical company, Alon, estimates that an additional 1.1 million bottles will be available at pharmacies and retailers across Canada for the month of January. This is very encouraging news, as we are starting to see some good signals that the overall pediatric analgesic supply situation is starting to improve.